Hello, and welcome to this webinar about culturally and linguistically appropriate services in school nursing. My name is Rita, and I'm part of the Think Cultural Health team. Presenting with me will be Monica, a registered nurse and a nationally certified school nurse. The information we present in this webinar will help you provide the best care possible to every student and family you serve, no matter their cultural or linguistic background. We also created a discussion guide to accompany this webinar, designed to guide a small group of school nurses through a deeper exploration of the information in this webinar. It provides talking points, discussion questions, and group activities. You may find this webinar and discussion guide at www.thinkculturalhealth.hhs.gov. This webinar is a collaboration between the National Association of School Nurses and Think Cultural Health, which is an initiative of the Office of Minority Health at the U.S. Department of Health and Human Services. The Office of Minority Health works to improve the health of minority populations through the development of health policies and programs that will eliminate health disparities. Let's get started. School nurses should strive to provide culturally appropriate care every day. Let's put these strategies into the framework of culturally and linguistically appropriate services, also known by its acronym CLAS. School nurses play a pivotal role in navigating a child's health. It is essential that we be sensitive to the cultural and linguistic needs of each individual child. As our communities continue to evolve and diversify, school nurses must be able to understand different cultural beliefs, practices, and needs in order to best address students' health. By being culturally sensitive, school nurses can also build the trusting relationship needed to really know their students' and families' needs. These therapeutic relationships help contribute to better outcomes in healthcare and consistent school attendance. How do we then develop sound working relationships with the student and family unit? By using this framework, CLAS. CLAS can help you provide better care to the students and families you serve and build that trusting relationship you need with them. CLAS is defined as services that are respectful of and responsive to individual cultural health beliefs and practices, preferred languages, health literacy levels, and communication needs employed by all members of an organization, regardless of size, at every point of contact. Every healthcare encounter is a cross-cultural interaction. You should consider not only your students' and families' cultures, but also your own culture and your school's culture. Keep this in mind as you seek to best respond to the health needs of the diverse communities you serve.
Hi, this is Monica. Thank you, Rita, for the introduction to this webinar. So why does CLAS matter in school nursing? First, let me give you a few examples. In school nursing, being culturally and linguistically competent may mean assessing and digging deeper when a child says they have felt that way for a while or uses other vague phrases such as "I feel sick." School nurses must peel the layers away of what the child specifically means considering cultural background. Using pictures and examples that are sensitive to your population. Graphics that do not depict the student's race or other cultural factors may lead to cognitive dissonance, where students and their families think that the information it presents doesn't apply to them. For example, in one instance, a family from Mexico was given a food exchange chart to help identify the number of carbohydrates in food for the family member who had diabetes. The exchange chart did not have any of the foods they traditionally ate, so the family threw it away because they thought the concept did not apply to them. Learning how to work with an interpreter and ensuring the interpreter knows the appropriate terms for the country of the person needing services. For example, recognizing that a Spanish-English interpreter may use the term curandero to refer to all medical personnel, although traditionally it refers to traditional healers, and if not explained further, the family may not seek care from a licensed physician, but rather a traditional healer. Why does class matter? Changing demographics create challenges in providing class, especially in areas of the U.S. that were previously less diverse. If students and families do not feel comfortable, or there has been a misunderstanding or lack of trust, then they will put up a wall and not share everything they need to share, or parents will tell children not to come to the school nurse. School nurses must be careful to encourage and be sensitive, verbally and non-verbally, and ask appropriate questions. School nurses must focus on strengthening relationships, building trust, and improving verbal and nonverbal communication with the student and family. Without trust, without a sense of acceptance and comfort, the student or family members may not ever disclose important information pertinent to the student's health. In these situations, sensitivity to the particular culture and linguistic needs of the student is as important as solid clinical skills. As school nurses, we strive to improve outcomes for the students. As health professionals, you know that a client's experience is much broader than one specific patient-provider interaction. School nurses are at the hub of communication between the student, family, school, healthcare provider, and community. Remember, every healthcare encounter is a cross-cultural encounter. Furthermore, communication challenges are not only related to language barriers, verbal or nonverbal. Health literacy levels, dialects, hearing abilities, and other communication needs, which aren't necessarily apparent at first glance, influence an interaction between a health professional and a student and family. When you consider each of these points of contact, and there are more, you can imagine the number of cross-cultural interactions and communications occurring in your organization on a daily basis. You, as a school nurse, facilitate communication and bridge gaps in the healthcare delivery system. One healthcare encounter with a student and or family, no matter how brief, can lead to health education, screenings, development of care plans, and other specialized healthcare services for acute and chronic illnesses or injury, which subsequently impacts the community as a whole. Because culturally sensitive communication enhances what information you gather, it is even more important, for example, to the parent who has only a few minutes while dropping off a medication before school, or when calling a relative of the student to notify them of an emergent situation. The student and family may fear encounters of this type because they don't understand the language. They may be in denial or anxious about the student's situation. Emotionally charged situations can lead to increased miscommunication between the involved parties. Every communicative exchange should be viewed as valuable. What do we mean when we say culture and health? Let's clarify what culture is. Though there are many definitions for culture, the U.S. Department of Health and Human Services Office of Minority Health defines culture as integrated patterns of human behavior that include language, thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. Culture encompasses all facets of an individual's identity, including linguistics, geographical location, spiritual and biological characteristics, gender identity and sexual orientation, economic status, and even abilities and immediate environment. Culture is dynamic in nature, never stagnant or simple. Individuals may identify with multiple cultures over the course of their lifetime. Every interaction is a cross-cultural interaction. Cultures present include that of the student, guardians, parents, grandparents, healthcare provider, and the institutional culture of the school. Presented with this challenging situation, how does a school nurse effectively facilitate culturally and linguistically appropriate services for the student? Be sensitive to the student's needs. Help them problem solve, keeping within the context of their values and belief systems in all situations. Always use layman's terms that everyone will understand and in nothing more than a 6th grade reading level. Let's look at a specific example of how different cultures interact. Have you ever heard of coin rubbing or cupping to treat health conditions? Cupping was seen by several athletes during the Olympics. It includes using a suction cup on areas to increase circulation. Coin rubbing is a dermatologically abrasive therapy, a type of folk medicine. This practice of rubbing a coin over oiled skin causes darkened striations or ecchymosis. Certain cultures believe it treats ailments such as migraines, fever, abdominal pain, even coughs and colds. Exploring your reactions to this folk medicine remedy, you may mistake it for domestic abuse or simply discount its value. Yet you cannot discount its importance to the family. Whether you agree or not, if it does not present a safety concern to the student, it may be suggested by the family as part of the care plan. Culture is even more complex in the school setting. Why, you ask? As previously mentioned, it is more than race and ethnicity. Culture in the school also includes sexual identity and orientation, generational identity based on age, ability identity based on talents and skills, and even specific interest identity such as academic, athletic, or creative pursuits. We may be confronted with the culture of homelessness, poverty, entitlement, or wealth. Can a student straddle cultures or have dual cultures? Yes, they can. Students may fit into several of the cultures mentioned above. In addition, a student may practice a more traditional ethnic culture at home as compared to the culture they portray in the everyday school setting. Generally, students gradually become more acculturated, or rather Americanized, compared to the family's cultural origins, especially if the family has immigrated in the recent past. So how does culture impact health? First, we must define health. The World Health Organization defines it as a state of complete physical, mental, behavioral, and social well-being, and not merely the absence of disease or infirmity. Health also includes spiritual well-being. This definition of health reflects the fact that many aspects of health influence an individual's well-being, just as many aspects of culture influence an individual's well-being. Health can only be truly attained when the student's cultural groups are identified, considered, supported, and acknowledged. Refer to the discussion guide, page 6, at the end of this webinar. Explore your thoughts on how culture contributes to your own health and well-being. Once you have completed the self-evaluation, think about the students with whom you interact and how culturally competent care will facilitate their individual outcomes. We have defined culture and health. We have determined the interaction between one and the other and the importance of both. How do you, as a school nurse, contribute to the synergy between a student's cultural identity and the attainment of good health? Communication is a key factor and sounds so simple, right? Inadequate communication, no matter what the cause, does not help to place the student or family at ease. Your communication may be the one factor in a brief interaction that enhances the future collaboration between the student, family, and you, the school nurse. The famous playwright George Bernard Shaw is credited with the quote, "The single biggest problem in communication is the illusion that it has taken place. Unfortunately, there is such a thing as good and bad communication." What does good and bad communication look like? Let's establish what is effective communication. It is a two-way process in which messages are negotiated until both parties correctly understand the information. The message must be unambiguous, timely, accurate, and complete. Effective communication is essential for all interactions and leads to comprehension. How do we know if there is a breakdown in communication? An easy way to tell is if things just don't move along. The plan in place doesn't happen. You might not even know what went wrong. The student and family may become angry and frustrated, blaming the school nurse for the poor outcome when in reality there was a misunderstanding. Communication is key. When communication breaks down, so does trust. Miscommunication and lack of trust affect the quality of the school nursing services you're providing, which can in turn harm the health of the student. How can we avoid this breakdown in communication? You might need to engage an interpreter or use translated material to accomplish the goal of the conversation. When working with interpreters or facilitators, specifically establishing trust and understanding with that colleague is crucial. A school nurse may need to advocate for appropriate interpreters or facilitators or the training of them in order to avoid misunderstanding between yourself and the student, parent, guardian, or other family members. Some key factors when using interpreters or facilitators are not using traditional words that may be misunderstood, verbalizing the exact intent of the words that you are saying, and on the part of the interpreter, not selectively deciding what he or she feels is important for the parent to hear, but exactly what the nurse is saying. Appendix D at the end of the webinar is entitled Tips for the School Nurse When Using an Interpreter. This tool highlights the 4 areas that must be addressed when using an interpreter. Ineffective communication leads to communication breakdowns. There are different forms of ineffective communication. This could include not being able to communicate in the preferred language of the student or family, personally or with an interpreter. It can also mean nonverbal cues. For example, Native Americans and other cultural groups may not look the nurse in the eye as a sign of respect, and the nurse may interpret this to mean they are not listening or they do not care. We haven't mentioned our educational colleagues. Health and education are 2 different cultures, and school nurses must be aware of this when speaking to educators about issues. For example, a principal could not understand why the nurse was so upset and insisting on healthcare intervention for a student who was cutting. The principal thought the nurse was speaking about cutting class. The nurse was speaking about the student cutting themselves physically. The school nurse left thinking the principal was insensitive, and the principal thought the nurse overly emotional. Due to this miscommunication, important services were delayed for the student. Ineffective communication impacts nursing care. It can occur in student-provider interactions, parent-provider interactions, and more. Another example of ineffective communication occurred when a family received antibiotics for a respiratory infection. However, the patient was not getting better. The family insisted they were giving the medication 2 times per day as directed. Finally, someone asked how they were giving it. The family had been crushing the pill and putting it in a hot poultice that they laid on the chest of the patient. This was commonly done in their culture, and so they never thought to swallow the antibiotics. What appeared to be non-compliance was really ineffective communication. The consequences from ineffective communication can include non-compliance, loss of treatment time, increased frustration and anxiety of the student, family, or nurse. So what happens when culture, communication, and care come together? Can there be a confluence of culture, communication, and care? Confluence means flowing together or coming together of factors or ideas, or even of diverse cultures in one geographical area. The answer is yes, there can be. To achieve the blending of ideas or a merging of cultures, we must take a more in-depth look at communication. Culture influences the way an individual communicates verbally and non-verbally. Examples of non-verbal communication are assertiveness, gestures, eye contact, facial expressions, personal space, posture, and touch. Depending on the cultural group, each of these vary from one extreme to the other. You have groups where personal space is non-existent, and in others where conversation occurs several feet apart. Eye contact may be a taboo in some cultures, and in others, if you don't look at each other when conversing, it is deemed as inattentive. Verbal communication includes conversation structure, emphasis, tempo, intonation, listening, turn-taking, and volume. Let's use one sentence, never changing the words, to exemplify how verbal communication based on the factors mentioned above change the meaning completely. I do not have any pain. No change in emphasis, volume, or intonation. Hard to determine what is meant at all. I do not have any pain. Emphasis and intonation change. I sounds as if this person wouldn't admit to having pain even if it was present. I do not have any pain. Emphasis and intonation change. Sounds irritated or frustrated. I do not have any pain. Emphasis and intonation change. Sounds impatient or upset. Can you hear the meaning change as the emphasis and tone change in each example? Think of how a student and their family feel when English is not their first language and they are trying to understand or communicate in a language other than that of their cultural group. As school nurses, we must consider that culture does influence or impact communication. Ask appropriate questions and do not assume comprehension is certain simply because you gave an explanation. For instance, prescribed eye drops were given to a student, but the family thought all Western medicine was taken orally. They were putting the drops in the mouth. When the child wasn't getting better, the school nurse asked additional questions and discovered this misunderstanding and had an interpreter help ensure they understood the treatment plan. Children often say they have a stomach ache. After years of experience in practicing cultural sensitivity within a particular cultural group, a school nurse realized that they meant nausea and not pain at all. The discussion guide provides additional case studies and an opportunity to contemplate your own experiences as you complete the exercises. School nurses must be intentionally considerate of a student's needs and the differences between the cultural groups, whether it be the culture of home, school, medical or nursing setting, or the general community, to ensure the integrity of all parties involved. Reflect on these points. If a school district includes refugee and or immigrant families for whom English is a second language, a parent's ability to understand English orally may differ from their ability to understand materials written in English. Families who prefer traditional or non-Western treatment protocols, including consultation with lay healers, may occur. Evaluate how you can improve situations of this type. Here are a few more situations regarding social customs that have occurred in the school setting. A parent from a poor, uneducated background immediately gets angry when the school repeatedly calls about her child's misbehavior. School staff assume the parent is uncooperative with the school. PTA leadership in an ethnically and socioeconomically diverse school is dominated by parents or caregivers of a particular societal group. Attendance and participation at PTA meetings are impacted. The school wants to enforce nutrition guidelines, which bans foods high in sugar and fat from family events, lunches from home, fundraising, and food vendors at school. The new policy gets pushback from the minority families because more often nutritious food is more expensive. There are many traditions surrounding food. It is a tradition in some cultures to feed people when they visit each other's homes. People considered their community school a home and were offended when the principal suggested that the school charge families when they came for special events. With all the information you have received and the examples given, there is one main question that you may be asking yourself. So back to Rita, who will help you explore the practical application of CLAS.
Providing CLAS can help you promote more effective, equitable, understandable, and respectful quality care and services to improve outcomes for your students and families. A helpful guide to placing these concepts into practice does exist. It's called the National CLAS Standards. It's a blueprint developed by the Office of Minority Health for operationalizing CLAS. The standards are an important tool for promoting and implementing culturally and linguistically appropriate services. The National CLAS Standards are comprised of 15 standards that inform and facilitate the implementation of culturally and linguistically appropriate services. As you see, there is a principal standard, number 1, that serves as the overarching goal for all the other standards. The rest of the standards are structured into 3 themes: governance, leadership, and workforce; communication and language assistance; engagement, continuous improvement, and accountability. Let's walk through these standards. Think of ways to apply them to your own work in schools, even if that means advocating for changes in school policies or procedures. The principal standard, Standard 1, shown here, frames the essential goal of all of the standards. Conceptually, if the other 14 standards are adopted, implemented, and maintained, then the principal standard will be achieved. Providing effective, equitable, understandable, and respectful quality care and services helps create a safe and welcoming environment at every point of contact that fosters appreciation of the diversity of individuals, meet communication needs so that individuals understand the health care and services they are receiving, can participate effectively in their own care, and make informed decisions, eliminate discrimination and disparities. Theme 1 of the National CLAS Standards is called Governance, Leadership, and Workforce. This emphasizes that implementing CLAS is the responsibility of the entire system. Implementing CLAS really requires the investment, support, and training of all individuals within an organization. Standard 2 underscores that CLAS must permeate every aspect of the organization, from the top down and from the bottom up. We know that leadership, in large part, determines whether the organization's culture will embody quality, safety, and class. Standard 2 will help organizations provide adequate resources to support and sustain CLAS initiatives, model an appreciation and respect for diversity, inclusiveness, and all beliefs and practices. Standard 3 has to do with recruiting, promoting, and supporting a diverse governance, leadership, and workforce. It will help organizations create an environment in which culturally diverse individuals feel welcomed and valued, infuse multicultural perspectives into planning, design, and implementation of CLAS. Standard 4 has to do with educating and training governance, leadership, and workforce. It will help organizations prepare and support a workforce that works well with diverse populations, assess the progress of staff in developing cultural, linguistic, and health literacy competency. The Communication and Language Assistance theme provides guidance on how to effectively meet patients' communication needs, including sign language, braille, oral interpretation, and written translation. The standards in this theme will help organizations comply with federal requirements such as Title VI of the Civil Rights Act of 1964, the Americans with Disabilities Act of 1990, and other relevant federal, state, and local requirements to which they may need to adhere. In thinking about providing communication services, you may consider inquiring what communication services are available through your school district and easily accessible to students and their families. Being proactive in having the necessary communication services and assistance available. This will help ensure that conversations and written communications will take place between the school nurse and the student's family on a timely basis, with clarity and no misunderstanding. If you are using the discussion guide, please reference Appendix B to review Standards 5 through 8 in more detail. Standard 5 has to do with offering communication and language assistance. It will help organizations make sure that individuals with limited English proficiency and/or other communication needs have equitable access to health services, improve patient safety, and reduce medical errors related to miscommunication. Standard 6 has to do with informing individuals of the availability of language assistance services. It will help organizations inform individuals with limited English proficiency in their preferred language that language services are readily available at no cost to them, facilitate access to language services. Standard 7 has to do with ensuring the competence of individuals providing language assistance. It will help organizations provide accurate and effective communication between individuals and providers, empower individuals to negotiate and advocate for important services via effective and accurate communication with health and healthcare staff. Standard 8 has to do with providing easy-to-understand materials and signage. It will help organizations make sure that readers of other languages and individuals with various health literacy levels are able to understand and access care and services, enable all individuals to make informed decisions regarding their health and their care and services options. Engagement, continuous improvement, and accountability underscores the importance of establishing both individual and organizational responsibility for implementing CLAS. Effective delivery of CLAS demands actions across an organization. This theme focuses on the supports necessary for adoption, implementation, and maintenance of culturally and linguistically appropriate policies and services, regardless of one's role within an organization or practice. All individuals are accountable for upholding the values and intent of the national CLAS standards. As a school nurse, take time to be proactive and determine what resources already exist at the district and community level. Help support school and district level advocacy for the standards. By familiarizing yourself with the first 8 standards, you will be better equipped to help your educational institution to establish, analyze, improve upon implementation of the national standards. Standard 9 has to do with infusing CLAS throughout the organization's planning and operations. It will help organizations make CLAS central to the organization's service, administrative, and supportive functions. Link CLAS to other organizational activities, including policy, procedures, and decision-making related to outcomes accountability. Standard 10 has to do with conducting organizational assessments. It will help organizations assess performance and monitor progress in implementing the national CLAS standards. Obtain information about the organization and the people it serves, which can be used to tailor and improve services. Standard 11 has to do with collecting and maintaining demographic data. It will help organizations accurately identify population groups within a service area, monitor individual needs, access, utilization, quality of care, and outcome patterns. Standard 12 has to do with conducting assessments of community health assets and needs. It will help organizations determine the service assets and needs of the populations in the service areas, needs assessment, identify all of the services available and not available to the populations in the service areas, resource inventory and gaps analysis, determine what services to provide and how to implement them based on the results of the community assessment. Standard 13 has to do with partnering with the community. It will help organizations provide responsive and appropriate service delivery to a community, empower members of the community in becoming active participants in the health and healthcare process. Standard 14 has to do with creating conflict and grievance resolution processes that are culturally and linguistically appropriate. It will help organizations facilitate open and transparent two-way communication and feedback mechanisms between individuals and organizations, anticipate, identify, and respond to cross-cultural needs. Standard 15 has to do with communicating the organization's progress. It will help organizations convey information to intended audiences about efforts and accomplishments in meeting the national CLAS standards, build and sustain communication on CLAS priorities, and foster trust between the community and the service setting. So as you have heard more about the CLAS concepts, do you see how they fit into school nursing? Providing CLAS includes understanding your student and family population by researching and taking into account race, language, religion, socioeconomic status, and other demographic characteristics. Honing your communication skills in interactions with parents, teachers, students, health techs, and interpreters. Implementing CLAS knowledge into healthcare plans and other day-to-day activities. Training school staff in CLAS. Using the national CLAS standards as a tool for identifying and acting on CLAS-related opportunities. Ensuring all school-home communication is in the primary languages of the student population. Providing signage in schools that are mindful of the populations they are serving. For example, the directional sign for main office should be in multiple languages. Recruiting people from less empowered subgroups of the school and training them as ESL teachers, PTA members, wellness committee members, and/or school governance members. Sharing data with school leadership about demographic rates of student referrals for health accommodations, discipline, and special education to spark conversations about disproportionality. Including diagnoses in care plans that address factors such as being new to a country or address family dysfunction. You may find the acronym LISTEN helpful. Listener, intentional, supportive, trusted, ethical obligation, non-judgmental. It's also important to reflect on your own cultural beliefs and practices and biases. For example, including phrases such as family dysfunction in a care plan may appear insensitive to others. Empower subgroups to speak, even if it is among themselves. Let them lead and share. You may be able to list other ways that the concepts may be applied, expanding on the ideas we mentioned. Where can you learn more about CLAS and the National CLAS Standards? Think Cultural Health is a valuable resource for you. Think Cultural Health houses the National CLAS Standards and the Blueprint, a guidance document that describes each standard and its purpose, and along with some strategies and resources for implementing each standard. Think Cultural Health also offers a suite of free, accredited e-learning programs, including one for nurses and social workers.
The National Association of School Nurses has developed an effective resource entitled Cultural Competency in School Nursing that you may reference. The web address has been provided for your convenience. If you have any questions regarding that presentation or any other related inquiry, please contact NASN at the email address given. It has been a pleasure to share this topic with you. Thank you, Rita, for co-presenting with me.
Thank you all for listening to this webinar. We hope this information about CLAS will be useful in your day-to-day work. Please visit the Think Cultural Health website to access more resources about CLAS, including a discussion guide for this webinar. Thank you again.